COVID-19 status in the country. The Ministry of Health has confirmed that it will start administering booster shots from January in 2022. Now, this comes at a time when COVID-19's positivity rate stands at 32.7% in the last 24 hours. The government has also allowed mixing of vaccines in case of adverse effects, except for children and pregnant women. Our health and science reporter Belden Waliaula has more on the new COVID-19 vaccines guidelines.
According to the Ministry of Health, the strength of vaccines being administered at the moment wanes with time. Due to this, COVID-19 boosters will be administered to Kenyans to keep them going. Those eligible to receive booster shots are the ones who have received 2 doses of AstraZeneca, Moderna, Pfizer and Sinopharm vaccines. The Kenya National Immunization Technical Advisory Group, or KENITAG, has provided guidelines on how these booster shots will be issued. Pregnant women will be offered mRNA vaccines, which are either Pfizer or Moderna. The expectant mothers who had already been vaccinated or began the process with other types of vaccines should not mix vaccines. Only Pfizer vaccine will also be given to children aged 15 years and over. Individuals who have been fully vaccinated with 2 doses can be offered an additional dose of either AstraZeneca, Moderna or Pfizer, but 6 months after completing their primary vaccination. In case of a serious reaction or adverse effects after the first jab, one is allowed to switch to a different type of vaccine for their second dose. Clarifying further, the Ministry of Health says if one suffers adverse effects after receiving Pfizer or Moderna, which are mRNA vaccines, the AstraZeneca vaccine will be administered as the second dose, but 28 days after receiving their initial jab. Meanwhile, the Ministry of Health has also given a go-ahead on mixing of vaccines. Now, an individual who has received the first dose of Moderna vaccine can receive AstraZeneca as their second dose 28 days after Moderna was administered. But the ministry also allows one to receive Pfizer or Moderna vaccines as his or her second dose after 8 weeks in case the person suffers adverse effects due to AstraZeneca, which is a vector vaccine. Besides, the numbers of COVID-19 infections have been rising, with 3,749 people testing positive for the virus. 703 patients are currently admitted in various health facilities countrywide, with 15,302 being under home-based care program. 2 patients have succumbed to the disease. Belden Waliaula, KTN News.
Let's now talk about Christmas.